when you look at drug ads on television,
Yeah.
this is something that I'm actually fired up about. You don't hear very many people talk about it. You guys have been talking about it. Put on any program. I mean, I watch NFL games. I saw Travis Kelsey constantly saying, get your 2 shots, your flu shot and the COVID shot, 2 for 1 over and over again. The percentage of ads in general for prescription drugs. You can correct me if I'm wrong, but I think it's the United States and New Zealand are the only 2 countries basically in the world that don't restrict in any way prescription drug advertising. What are you optimistic we can dial that back, or is the big pharma industry, in conjunction, frankly, with media, which makes a lot of money on these ads, is it too powerful to change that? And what would the impact be if we dialed back the ads?
I will say one thing on your last point. No industry is powerful enough to stop what President Trump is trying to do to reform institutions. I will tell every voter that the sword they've given President Trump is being used to drive great institutional reform. So we always talk about these big moneyed interests. I heard this from senators years ago when I was meeting with them. This wasn't a voting issue. They said voters are more powerful than money.
What the FDA, what they've talked about looking at, is that we didn't have pharma ads really in 1997.
Yeah.
It hasn't been that long.
It's exploded.
It hasn't been that long. And actually, in those other countries, they're not all fully banned. They just require more consumer disclosure, which makes the ads impractical. So there's a clear constitutional precedent that consumers need to be informed correctly. And I think it's very clear that since 1997, when before that you had to read more of the package insert, more of the side effects, the ads need to be 4 or 5 minutes long. They shortened that based on a lot of lobbying, and pharmaceutical prescriptions have exploded and sickness has exploded. So I think it's very clear consumers are not being informed correctly. Patients are not being informed. And I know that the FDA is going to be looking very hard at that through the lens of making sure patients get the right information.
It's interesting. I was reading a study. There's a lot of talk because at OutKick, obviously, we focus a lot on sports. And people were very obsessed and upset sometimes with the amount of sports gambling ads that suddenly flooded television. So, but drug ads are 37 times, according to this study I was reading, as prominent as sports gambling ads, which really kind of blew my mind. Obviously, it depends on the programming that you're watching, but it is interesting.